We spent a lot of time today trying to figure out who's telling the truth about vaccines in southern Wisconsin. Mercyhealth in Janesville says it received none for the second straight week, but the state told us that's not true.
Now, no matter who is telling the truth, it's the patients who thought they were going to get a vaccine and instead had their appointments canceled. Amanda Quintana shows us that lack of supply, it's affecting a lot of patients.
The third time that you're told you've been moved back in the list, it's hard.
Jane Dowdy has had several appointments for COVID vaccine, finally thinking her February 20th one at UW Health would stick. Then she got the text last night, rescheduled to mid-March.
They say how sorry they are. They say, how unfortunate it is, but then they end with, just be patient. And well, that only goes so far.
She's not alone. Hundreds of patients in our area are facing the same delays.
You're on this emotional roller coaster where, I really don't want to get sick. And we've been really, really good. But I keep thinking the longer this goes on.
Mercyhealth says they were forced to cancel almost 500 appointments this week, claiming they got 0 first doses for the second week in a row. At UW Health, even though they have the ability to vaccinate 7,000 people a week, they're still getting only about 2,000 doses.
DHS is using a blended approach where they're adding more and more vaccinators. And when you have the same pool of vaccine to distribute, that means that some of the larger systems are not going to get as much.
And it doesn't look like UW Health will be getting any big increase anytime soon. Dr. Matt Anderson says they're working through those scheduled, but if their patients can find a vaccine somewhere else sooner, they want to help.
Going out and trying to find it in one of 15 or 10 or 20 places or however many it is work for people to do, and there's a lot of emotion that goes with that.
Dowdy stayed up checking her account every 2 hours last night, finally finding an appointment this morning, but knows not everyone can do that, and they shouldn't have to.
There's people without smartphones, without computers, they're relying on their kids to try and their kids are working full time. It's just mind-boggling.
Amanda Quintana, News 3 Now.
DHS says they take a list of things into consideration when choosing where to allocate vaccines, and there just isn't enough to go around. UW Health is trying to compile information to help patients who might want to try to find a vaccine elsewhere.